Some of the images you're about to see might be disturbing. Viewer discretion is advised.
When we speak of mental health, we mean our emotional, psychological, and social well-being. It affects how we think, feel, and act, and determines how we handle stress, relate to others, and make choices. And anyone can be affected by a mental illness, including children. The Child Guidance Clinic at the Branford Tate Polyclinic was set up to help children who have a mental illness or are displaying behavioral issues. Staffed by 2 psychiatrists, Dr. June Price Humphrey and Dr. Stacey Ann Cushney-Lowe, some services are outsourced to the Occupational Therapy Department of the Psychiatric Hospital, as well as the Ministry of Education.
Okay, so not everyone who comes to the Child Guidance Clinic has a illness, a disease, a disorder, but most of them come with behavioral challenges, and it's sometimes difficult to discern why this particular behavior is occurring. And the same behavior in 2 children may be due to 2 completely different problems. The same problem in 2 children can manifest into completely different behaviors. So some of the social problems we see the abuse, including in the home, bullying, or violence that they may witness in their society. Sometimes a child is disturbed because of just a dysfunctional family setting. And the parents will say, well, wait, I know why they're acting up, so I hit them, I do this, I do that. But the child is responding to the environment around them. So if the environment is really dysfunctional, the child's going to respond to that, right? But then we have children who have actual disorders. So we have the ADHD, which is attention deficit hyperactivity disorder. A child with ADHD can be very restless. And those are the ones that people see easily because they're all over the place, they don't settle, they're talking too much, they're running around. But then there's some who are not quite so restless, but they're not doing their schoolwork, they're daydreaming, they're the inattentive ones. And people would just call them lazy or dunksy or other situations. People don't believe that children can become depressed, but children do become depressed. So we have children who have depressive disorders. Sometimes I have a parent come in and say, but yesterday she was laughing, so she can't have depression. The thing about a young person is that they can still respond to their environment, right? So I can have a young person who's telling me that they feel sad all the time. They've had thoughts of harming themselves, or they have actually cut themselves. They've had thoughts of dying. But yet the friend comes and says, okay, let's go to the park, let's go to the movies, let's watch TV, let's play video games, and they will do that. And the family will say, well, she can do that, or he can do that, nothing wrong with him. But the child will say, no, I'm doing these things, but I'm still really feeling bad inside. We have children with anxiety who are afraid for numerous reasons, whether it is that they're under a lot of stress or whether it is just something intrinsic. Because there's some people who are very sensitive, what you call a sensitive person. So everything seems to affect them. They get nervous very easily, they're shy, whatever the case may be. We have a lot of aggression for various causes, a lot of angry young people. We have conduct disorders. So these are young people who are not just acting out now, who are committing criminal acts of some sort. And then there's some young people who we call oppositional defiant, who they're not committing a criminal offense, but everything's a problem. And they just never seem to do what you want them to do. You tell them to turn right, they turn left. You tell them to sit, they stand. They're just doing the opposite of what everyone else wants them to do. And they're frequently getting into trouble.
The first step in helping a child with any of these symptoms is to admit that there is a problem, as opposed to deeming them as bad behave, indifferent, want lashes, or they're just like the father or mother.
If a child is misbehaving frequently, then it's a problem, right? It's not just something that's lacking in them. There's something that you need help with. A child does not grow up in a vacuum, in isolation. So anytime we have a child with a behavioral problem, we have to address the causes. Causes may be biological, maybe there is something intrinsic to them, but that is not the majority of the cases. The majority of the cases that this child is responding to something in the environment. They've either learned this bad behavior, they're responding to someone else, or say they have ADHD or a learning disability. Children respond to their environment. So it's impossible to manage a child in the absence of looking at the family, interventions with the parents and the school. If you're trying to do things with the child themselves and leaving the dysfunctional society as it is, you're not going to make much of a headway.
Dr. Price Humphrey is concerned that the misuse of social media is responsible for normalizing aggression.
Every day there are things on the social media, on the internet, on Facebook, with young people misbehaving, whether it's violence, whether it's inappropriate sexual behavior, whether it is bullying, it's, whatever the case may be. Every day there is something being circulated out there. And my fear is that young people coming up in this digital native generation where, the smartphone and the tablets are second nature to them. They learn it the same way they learn the ABCs. They're going to think that this is normal, that it's okay to videotape someone having an inappropriate, intimate relation with another teen or with an adult and passing it around from phone to phone to phone, and that this is normal, that this is acceptable, without understanding the consequences of that. The consequences being either the shame that the person in the video may be feeling, that some people who are exposed to those videos are unprepared for what they're about to see. So someone sends you this link and you click on it, and there is someone who's either bleeding or whatever the case may be. And the young persons are going to think that this is normal, and it is not normal. It isn't appropriate. Your psyche is not made up to have an onslaught of these kind of images 24/7. It's just not. We are not made that way.
As a result of the stigma surrounding mental health, many people do not admit that their child has a mental disorder.
People would rather say, I have a really bad behaved child, than to say, I have a child who needs help. But help is available, and it doesn't always have to be in a mental health setting. I mean, they're your pastors, they're your teachers, they are responsible adults out there in society. We just have to be willing as a society to let these persons intervene. If you don't know how to do something any better, if you've tried your best with your child and you're not getting anywhere, get help. Don't just sit there, blame them, blame the school, blame everyone else, and then, 10 years from now we have a generation of young adults who just don't know how to find their way in the world without aggression. If you have a child and you have a concern about them, seek advice from someone who is experienced in this area, okay? Because not every problem may be a mental health problem, but if it's challenging, don't wait for the child to grow out of it. Often dysfunctional children become dysfunctional adults, and by then it's harder to fix a broken adult than a disordered child.
Once a child and a parent secures an appointment at the Child Guidance Clinic, the first step is to have a conversation with both parties, together and separately. And your diagnosis is personal, and this relates to both children and adults and regarding any area of health.
You are under no obligation, if you go to the doctor and they tell you have diabetes, to disclose the fact that you're diabetic to any and everybody that walk in the street. But sometimes adults seem to think that because you're a minor, you have no right to have some privacy, and seem to think that I could tell all my friends, whatever the case may be. And sometimes the way it's said makes the child feel worse or creates a worsening situation. But we don't want a situation where you feel you have to hide either, right? If you feel you have to hide to come and see the doctor, then that is creating a second set of stressors. So we always negotiate who to disclose to, who we're going to work with. So for instance, if a child is coming, they're having a lot of academic challenges, of course I'm going to discuss with the parent and child that I want to talk to your teacher, or I want to talk to your guidance counselor, okay? If a parent says to me, no, I need to respect their right to privacy.
The Occupational Therapy Department at the Psychiatric Hospital assists children in identifying their anger triggers and then in choosing appropriate behaviors. They generally see around 5 persons a day, many from schools, the probation department, and the government industrial school. Lenox, Rochester, explains what may be causing so many young persons to appear to be angry.
Anger is always a secondary emotion, all right? So very often if they get frustrated if they're faced with a difficult situation. You know, young people have this thing about being disrespected, which is a primary emotion. Anger usually follows. And our thing with them is the process is not for them not to get angry, but to have angry thoughts, angry feelings, but not choose angry behaviors. You'd understand that that takes some doing, all right? And it's usually a challenge for them because lots of them don't think about the consequences that will come down as a result of that. I would say Barbadians have some challenges with expressing emotions, all right? And thereby, if you have problems with expressing, then there are issues that will follow that in terms of managing, especially strong emotions. It's sometimes taught, it's also modeled, and I know there's some schools of thought that relates it back to the diaspora and all that, but each of us have a responsibility to manage our behavior. You can't manage or control anybody else but you. And so we need to put some energy in managing how we behave. Of the adults that come to me, I would say 90% of the behaviors that I see would have started in childhood, and some of them not necessarily recognized as problematic. We have this thing, he will or she will grow out of that, and they don't necessarily grow out of it, they grow into it, but it changes at different levels, all right? And there are different stages in life where that comes out. College life, change of environment, getting married, another change, and certain behaviors then are exacerbated within those contexts.
The sessions generally run for 6 weeks and are done on an individual basis, but sometimes group sessions are held. Some parents are receptive to the treatment program, and this is very helpful, but some parents do not attend. Family support is critical, as well as a supportive school environment.
Now, if you consider family as a wheel and a spoke is bent, obviously that wheel is not going to flow smoothly, right? So it's critical that the family is there and they recognize what's going on with that person, because very often it's a symptom of something that's happening within the family setting. Now, we need to understand that influences outside the home are critical. School is a critical shaping institution for all people. All right, so school environment is great. That's where we learn not only maths, English, we learn social behaviors, we learn all sorts of behaviors, and that environment needs to be looked at critically.
The occupational therapist expressed concern that not only is he seeing more anger emanating from young people, but now, more than ever, from persons under 10 years old.
Previously, you would be between, let's say, 13 and 16. We go up to 18. All right, but I'm seeing a lot of on the 10s now, and that worries me. And I'm beginning to think that they're learning this behavior either from home or from the environments to which they're exposed. From my perspective, I would say it's usually 3 boys to 1 girl. However, it seems to be increasing, and that's something that I'm looking at. We recognize that people play a lot of video games, all right? A lot of them involve violence and negative behavior, all right? And there's usually no sanction, all right? So, and there are also a lot of subliminal messages coming out of those video games. So when people watch them and play them, they can do things that they will not be sanctioned for. There'll be no punishments, and sometimes they carry that over into their everyday lives, and it becomes a learned behavior. So we need to look at the kinds of games that our children and that we play. You understand? We get emotionally hijacked by all the violence and all the aggression because it feels good, but the outcome of that is not good.
He insists that more professionals are needed to help young people and adults to understand their feelings in order to better manage them.
We as adults need to be aware of the behaviors we choose because we teach them. You know, we teach them, we don't recognize that they're watching us. You understand? So we teach them, we might say something, but we show something else. So we need to be aware of the behaviors we demonstrate, and we need to listen to them sometimes. All right, and I mean listen objectively, all right, because very often that behavior is telling you something that they're not going to say verbally.
If you'd like to know more about the Child Guidance Clinic, why not give them a call at 826-3182 or 3183.